I'm going to speak on this topic. Thanks for all the mentors who have actively participated in this multicentric trial. There are various techniques of performing lumbar discectomy. The main goal of each technique is to relieve the patient from their symptoms. There is always a claim of one technique being better than the other. However, the evidence in the literature is low, and there is no single study comparing all the techniques. So the authors venture to assess the perioperative factors, outcomes, and complications of each procedure and compare them. The aim of the current study is to assess the functional outcome in the form of VAS score and ODI scores, operative outcomes, and complication rate. This was a retrospective study where the consecutive patients that underwent discectomy using the following techniques were included. They were broadly classified into minimally invasive group where tubular, endoscopic, and distensive techniques were included, and open group where open and micro discectomy were included. Surgeons with minimum of 5 years experience were included to have a level playing field. The premise was set for 2 years follow-up. Data collection was initiated in July 2019. These were the 10 centers that participated in the study. The single level lumbar segment with age more than 15 years and failed conservative treatment were included in the study. Patients with stenosis, instability, and calcified disc were excluded. These were the statistical tests that were run, and P values less than 0.05 was considered as statistically significant. These were the demographic results where sample size is 946 and male to female ratio is 568 to 378. Coming to the VAS score of the leg, there is significant improvement compared to pre-op. However, there is no statistically significant difference among the group. This can be attributed to the experience of surgeons in understanding the nuances of the technique to decide the end point of discectomy. Coming to the VAS score of the back, there is a mild superiority of minimally invasive group compared to open group at 6 months follow-up. The correspondingly reduced tissue trauma can be attributed to this. Again, in ODI score, there is no statistically significant difference among the group. Maximum improvement is seen in the first 6 months. This explains how the quality of life improves after discectomy, irrespective of the technique used. Operative time is high in open group compared to minimally invasive group. The need for exposure, hemostasis, and closure possibly prolong the operative time in this group. Blood loss is high in open group compared to minimally invasive group. Better visualization of the vessels and under magnification can be attributed to this. Hospital stay is high in open group compared to minimally invasive group. However, this cannot be the best measure for the invasiveness of surgery, as other factors like insurance system and post-operative protocols affect the outcome. Incision size is high in open group compared to minimally invasive group. This can be a contributing factor in patients' decision making to choose one technique over the other. The total complication rate is around 12.89%, with most common being recurrence and least common being the deep infection. A particular pattern can be made where recurrence and reoperation are comparatively high in minimally invasive group, while wrong level surgeries and infections are comparatively high in open group. Coming to the limitations, this is a retrospective study. The anatomical location of the disc herniation is not included in the study. The study doesn't analyze the perioperative costs incurred. In conclusion, this is the first study to compare all the prevalent techniques across the globe. Minimally invasive techniques have some advantages in certain perioperative factors, but all the techniques provide similar pain relief and functional outcome at the end of 2 years. The minor differences in the incidence of complications were not statistically significant. The various rates of individual complications provides a reference value for future studies. Thank you.